guys, welcome to this video. I'm John Zombro, physical therapist and performance coach here at the Lifetime Athlete, where our focus is to help you to become hard to kill on the playing field and in the game of life. At the Lifetime Athlete, we celebrate athletes of every type, every age, and every ability, and we also recognize the backcountry hunter as human history's original athlete. So today I'm going to be talking about a common injury, actually which occurs throughout the athletic population and even the general population, but it is particularly problematic for the backcountry hunter and the mountain athlete, and it's this. It's forefoot pain, more commonly known in, let's say, medical terminology via the umbrella term metatarsalgia. And the reason that is because our feet have these metatarsal bones. So behind each toe is a shaft or a metatarsal bone. We have 5 of these, and they have a thickening at the front, which is known as the head. And that's where this problem comes from. You can simply have a sore forefoot, and that's kind of the earliest stage of metatarsalgia. But over time, if the irritant is strong enough or long-lasting enough, it's potentially the case that we're going to develop some irritation of the interdigital nerves. And so there are nerves, among many other things, such as blood vessels and muscles, which run between each of these metatarsal shafts. And nerves throughout the body are a bit sensitive, a bit delicate. They don't like to have too much in the way of friction or pressure upon them. And when we develop the more advanced stages of metatarsalgia, we will get this irritation of the interdigital nerves. Now that can be called an interdigital neuropathy, neuralgia, which is a fancy term for pain, neuritis, which suggests inflammation, and you've even probably heard of neuromas, and the most common one being the Morton's neuroma, which tends to occur in this region in the midfoot. So, talking about this problem, metatarsalgia, I think I want to go through a number of things. And the first is, why is this injury or issue so common in backcountry athletes? And it's probably because of these factors. Most backcountry hunters and mountain athletes are going to be negotiating rough terrain at least some of the time. Typically wearing fairly substantial boots, often carrying loads sometimes quite heavy, and also putting on quite a bit of miles or kilometers in their pursuits. And so all of those things can come together to create the potential for this metatarsalgia condition. If we take a quick look at the anatomy of the foot, and particularly of the forefoot, what I had mentioned before was we have these metatarsal bones, and within them, between them lie these interdigital nerves. Now that will exist not unlike this pencil between my fingers, and if I was really coordinated, I'd actually put a pencil between all of the fingers and show that there's a nerve existing between each of these metatarsal bones, and there is. So I wanted to have you appreciate that issue, first of all. Second thing is, this model may not give it the most pronounced view, but we have 3 arches in the foot. We have the most common one that you think of as the medial longitudinal arch. We have a lateral longitudinal arch, but we also have an arch across the forefoot called the transverse metatarsal arch. And this is actually a dome-shaped presentation of these metatarsal bones. And the foot is designed, when we load it, when we walk, to compress or lower that arch temporarily, and then it rebounds as we come off the ground and go through our swing phase. And so when we're going from stance to swing, that metatarsal arch, and this is kind of the functional aspect of how the forefoot behaves, will flatten down and also spread out a little bit, which is sometimes called splaying of the foot. And you can see this in your own feet when you walk barefoot on, let's say, a smooth level surface. You'll notice that the feet are doing that. So what can happen, though, is when we have this kind of crowded and busy and unique anatomy, and we're undergoing those cycles of having the transverse metatarsal arch lower and the foot splay. Well, we can have increased compression in these vulnerable areas. I guess I should show that a little more specifically in those vulnerable areas. Most commonly, this is going to occur between metatarsal heads 2 and 3 and 3 and 4. And one of the reasons is that is actually the middle of the foot. And so if you can envision this kind of bending down, that's where we're going to have most of our pressure, versus when it's domed up or arched up, there's going to be more pressure on the outside. So that's kind of how this thing works. Well, if we have a loss of that normal cycle of movement, so we want the arch to be able to move. And that loss can be in any number of ways. It can be that the arch doesn't flatten and splay, that can cause issues, or it stays splayed too much and doesn't rebound and reform that critical arch shape. So we talked about the anatomy, we talked about the function. The primary problem is, again, this issue of compression. And now there are some specific causes for it. First of all, I'm going to say that there could be more than the 4 that I'm going to offer up today, but there are 4 that we're going to talk about. And so the first would be the presence of foot hypo or hyper mobility. And that's just describing, does your foot move too little or too much in this region, but also throughout the foot and even up the chain through the leg and the rest of the body. All these things can have impact or relate. Well, one of the challenges that we face as modern humans from chronic shoe wearing is we typically have feet that are both stiffer in most cases and weaker than they could or should be. And so this does make us a bit vulnerable to having this condition. Next up, and this is where I think a lot of backcountry athletes are going to be really interested in hearing, is we can have issues with boot fit. And basically where this comes into play is, let's say if the boot that you're using has a toe box and a forefoot area, which is too narrow for your foot, and it won't allow those metatarsal bones to spread and splay. This can cause a problem because that splaying actually gives a little bit of separation between the bones, so that nerve is under less pressure. So if the foot is flattening down and increasing pressure, but it's not spreading apart because it can't, we're going to have a problem there. So that's an issue with, as not quite so much the toe box as it is right here across this metatarsal region of a boot. Now the next thing that can be a factor is the boot can be just too stiff. And so many manufacturers will have flex ratings for their boots, and that's both for comfort and for function, depending upon the terrain that you're on and the types of things that you're doing. But if your boot is too stiff, it will not allow for this natural movement to occur where there's a bending right here across these metatarsal joints, or metatarsal phalangeal joints, I should say. This is metatarsal bone, the phalanges are the toes, and so we commonly call this the MTP joint. Well, that needs to bend. This model doesn't articulate, but it needs to bend, and when it bends like this, as we are lifting the heel off and the shoe should be flexing, that's extension. We call that extension of the toes. If the boot's too stiff and it can't do that, then we're actually driving down with greater pressure here on those metatarsal heads. So that can be a problem. Then the final thing, which is an issue, is the boot can be a bit too long in terms of length for the foot. And where this comes into play is in the shoe manufacturing world, where the boot flexes. If I can do this, yes, you can see it now. This is called the toe break in shoe manufacturing terms. Your toes aren't breaking. It's just that's where the boot bends. Well, sometimes based on how the midsole is constructed or whether or not there's a shank inside the boot, that will dictate where the boot is likely to bend. If that lines up perfectly with this spot, your foot's probably going to be happy. But a lot of times, if the boot is flexing a bit forward of this area, what can happen is we're not getting enough facilitation of the bend, and we're getting that pressure problem yet again. So that's where that comes from. Just to review quickly, we can have feet that aren't functioning optimally, and that can be a problem. We can have a boot that's a bit too snug in the forefoot, one that's too stiff overall, or one doesn't flex in quite the right spot for our foot. Now, each of those 4 problems has a solution, a treatment, a remedy that we can utilize. So first of all, I would say if you have a foot that's suboptimal, and most of us do if we can admit that as modern humans, one of the things we want to do is we want to perform exercises to help our feet function as well as they can. So one of the things that you can do is super simple. You can do some mobilizing of the foot. If you happen to have a golf ball or a racquetball, something along these lines, you can put this on the ground and put your foot on it, barefoot or sock, and just gently roll around. Maybe not so much right on the heads of the metatarsals, but back in those in that shaft region, and you're going to be able to get some circulation enhanced and move those tissues a bit. You can also, see if I can hold this in this manner, you can grasp your metatarsal bones and gently mobilize them. You can do this one bone relative to the other. You can also create more of an arch or less of an arch, and you can rotate the foot this way. Doing these types of things, they're instinctive, but they can also help. But ultimately, when we're starting to talk about exercise for the foot, what we want to get into is performing some specific things. Now, we do a number of things clinically that involve various exercise protocols and other interventions. And if you're interested in that, you think you need that, you can reach out to me. We can do a therapeutic coaching consultation. But nonetheless, one of the greatest things is simply to do some of your exercise and training barefoot where it's safe to do so. So if you can be in the gym and working out barefoot or in socks for some of the things that you do, that is going to help let the foot function more naturally, get more mobile, get stronger. We have a number of muscles inside the foot, which we call intrinsic muscles, so intrinsic or within the foot, and they get a great benefit from this barefoot exercise, as do some of the longer muscles of the calf or lower leg and shin area, which cross into the foot. Barefoot exercise will help both those things. Also, if you can do some walking or possibly some running, if you do that in your training on sand or on grass at the beach or a field, this is outstanding for helping to improve foot function. Now, I'm not saying you're going out in the rugged backcountry barefoot or even with a minimalist shoe. I think they're great for training, but once you're out in the more rugged terrain, a boot designed for that is most appropriate. The other thing that these exercises will do over time is they will help to not only just build strength and mobility, but normalize those biomechanical functions of how your foot rolls through the gait cycle and how loads are born and forces are created. And I can't say enough good things about doing some barefoot training. So that's how you would address the foot itself, and most of us will benefit from that. But now we can get into the boot fit issues. And so first of all, with any boot, one of the things that you're going to want to do is try before you buy, or at least have the ability to exchange, and that's rampant these days. So very easy to finally find a boot that works for you. One of the things to keep in mind is every manufacturer uses a slightly different last or foot shape around which they build their boots, and it's proprietary to the brand, and many brands will use several lasts within their product lines for different models. So eventually you'll find one that fits well, and it's very important. Most boots, even the leather ones, don't have the capacity to change that much, and so you want to get that foot fitting and happy right off the bat. Now, let's say that things are close, but this isn't horseshoes, it's just not quite good enough. And you want to do some things to improve the forefoot the forefoot fit. Well, you can't change the configuration of the outsole, the width, that's static, that's fixed. But you can do things with the upper. So one of the things that you can do, and whenever we're talking about using heat around boots, I always want to make sure that we use a very, very mild heat. And never set your boots next to a wood stove. You can get the boot too hot. It can cause delamination at the midsole, or particularly around the rubber rand. It can void your warranty. So don't overheat your boots. But if you just mildly warm your boots to warm temperature or slightly above, you can use a ball, in this case a tennis ball. You can go to a larger ball like a baseball, or even softball, depending on the size of your boot, and you can wedge it in there and essentially leave it there while the boot's warm for perhaps several days, and it can help to just ever so slightly stretch and improve the fit there. Now you can go to a professional boot fitter and have some work done. They have some specialized tools for that, but this is a quickie tip to do at home. Another trick is using what's called parallel lacing. And so in this boot, what you'll notice is down at the forefoot where that toe break exists, I've run the laces parallel to the tongue, as opposed to doing the crisscross or any other type of lacing pattern. And in doing this, it creates a slightly less constriction, or slight lower amount of compression across the forefoot. So that's kind of a nice trick that you can utilize as well. The other thing that you can experiment with, and this depends on obviously the temperature that you're in, you can go to a slightly thinner sock. And if you're using a thinner sock and it's not too cold, that'll decrease some of the volume in this area, and again give your foot a little more room to move. Now, when we get down to thinking about the boot being too stiff overall, and you just need more ability to flex the boot, I'd do the same thing with heating. I would maybe put it near a heat register if you have forced air, or just in a warm spot. I wouldn't leave these out in the sun too much. UV light has a way of degrading things if it's done for too long. But I do that, or if you happen to have a heat gun, which is thermostatically controlled, and you can run it really low, like maybe only at about 100 degrees or not much more, and you use the appropriate distance from the boot, you can heat not only the upper, but you can heat the sole. Again, don't overdo this, and no manufacturer is probably going to recommend this, but this is one of the things that I used to do in the clinic for many years, working on boot fitting as one of the things we did for our athletes. You can warm this up, and then you can actually work on mechanically flexing the boot. Now you can obviously put it down on the ground and apply more force, and over time you'll be able to get the boot flexing a bit better. You can even wedge it into a position, depending on if you have heavy weights or something that you can do, to just create a little bit more of a bend or a potential rocker in the sole. You're not going to mess up the boot. These things are nearly indestructible, but you will increase that flexion a bit, and it may allow for a little more comfort for you. If your boot's too large, well, that's an interesting thing, because most humans will have one foot that's slightly smaller than the other, or larger, depending on how you want to say that. Well, usually this occurs on the smaller foot, again, because it's further back from the toe break and it's getting those pressure issues. So for any of these types of conditions, we start to think about other products which might be useful or applicable. And so whether there's controversy whether we can call these things orthotics or not by definition, but these are certainly replacement insoles, and they can be made from any number of materials, foam and rubber and cloth, cork. Well, these things will do three things. If the boots, actually they're going to do more, maybe let's say four things. If your boot's too large, first of all, you can take up a little volume. These are a little bit usually thicker than the stock sock liners that the shoe companies provide the shoes with. So you can put that in. Keep in mind, though, you don't want anything too big, because if we take up too much space, now we've decreased volume, we're going to contribute to that problem more. But again, a lot of these things we have to use trial and error. But what these devices do, the main three is this. They can increase cushioning, depending on the material. They can increase support, and whether you want to call that motion control or use other terms, we can talk about that another time. But the last thing they can do is they can increase total contact, or essentially become a total contact device. So in other words, we've eliminated all the airspace or nooks and crannies under the contours of the foot and filled that in. So the foot doesn't have to move hardly at all before it's in contact with this device. And that improves the foot-shoe interface and then the foot-ground interface, or shoe-ground interface, depending on how we're talking in. So sometimes that can help to make the boot work better in conjunction, in harmony with the foot, and also to decrease some of those pressures. The elephant in the room, though, is the metatarsal pad. So these are dome-shaped pads which are designed to be placed on the insole or sock liner. And what they do is they actually will push up underneath those metatarsal shafts and help you to maintain the transverse metatarsal arch and keep a little bit of that relationship optimized in the foot. The foot can still move on the pad, but oftentimes this is very effective. Now, one of the keys when you're doing this is you don't put this right on the heads where the painful area is, because that can actually make the problem worse. We want to go back here to lift, separate, and spread. And that, with a little bit of, again, trial and error, you can get them. In fact, you can find these almost any pharmacy or medical supply store these days. Again, different densities and sizes available. Many of these are self-adhesive, and they are quite effective in the short run at just helping you to alleviate some of these symptoms of metatarsalgia. What I like to do, though, oftentimes is work on optimizing boot fit and function, and then also foot health and conditioning, and we oftentimes, many cases, don't even need these anymore. So, guys, thank you for being with me today. This was a talk about metatarsalgia, and those forefoot issues, and those nerve irritations, which are so common for athletes of all types, but particularly backcountry hunters and mountain athletes. Thanks again for being with me. Until next time, this is Coach JZ signing out from The Lifetime Athlete.